Hi, I'm Dan Craig with Sunrise Medical, the Leckey sales specialist in the Northeast region. Today, we're going to be talking about the Squiggles Plus standard. Range for the standard is going to be 1 to 5 years old. It is going to have a max weight cap of 48.4 pounds, and it's going to have a height range of 28.5 to 43.3 inches. So Leckey's courageous goal is to prevent hip migration in children with CP by the year 2025. And so they're going to try to do that through this 3-in-1 standard. So it's supine, prone, and upright. And this one, since it is a plus, offers abducted standing. So the abducted standing is going to allow for more natural and a better, deeper socket for that hip. So we're not just relying on soft tissue to hold everything together. So let's get into some of the adjustments that you can do with the Squiggles Plus standard. So this is going to take one tool, and it is going to be your 5mm Allen, and there's going to be one screw back here. And so when you get this out of the box, it's going to be at its lowest setting. And so we're going to loosen this, and we're going to raise it up. Now there is a safety stop on here, so you're only going to be able to raise it so far, and there is going to be a stop. Typically, when you're adjusting this, you are going to want it as low to the ground as possible so that they interact with their peers as best as they can. Normally, you're going to raise this if they're doing some kind of special activity at a table or with an older sibling or older crowd that they're dealing with. And then that way they can be at an appropriate height. So now that we have this adjusted all the way up so that we can move everything down, you always start with the hips. And Leckey has always been about the hips, so we're going to start there. And this all moves together. So your hips and your legs, because we're the only 3-in-1 standard that anatomically moves correctly, the hip and the joints for the abducted standing move together. So there are 2 screws that are hidden behind this black cap and 2 round knobs that you're going to tighten and loosen. And that is going to allow this to move up and down. And you have to do both sides because it moves together at the same time. Move this down, and that's going to give you room to see everything. So you're going to want to adjust all this before you get the client in there. So there's going to be a couple key measurements while I'm tightening these screws down. So you're going to measure from the client's heel, laying down. So you're going to want client's heel up to their axilla or shoulder to get the chest prompt height. You're going to want to measure from the heel up to the ASIS, which is where you're going to want to put the pelvis, which is where you're going to want to put the pelvic pad in conjunction with the foot plates. And then you're going to want a measurement from the heel to the knee. And that's the way we can place these appropriately. Now, you can leave everything kind of, you want it snug, but gives you the ability to be close and fine-tune adjustments afterwards. So you don't have to bear down just yet. Leave it so that you do have some ability to grow up quickly. So once we've done that, we're going to move the footrest down. So your knee to hip measurement is 1 screw. And there's a push button on the back here to initially get it to go down. Now, it won't come all the way out. There is a safety, that push button. Once you get it fully extended, you can't go down any further. So all we have to do is push that button back in, and then we can raise it. And you have an infinite adjustment there. So you can bring it up, you can bring it down pretty easily. All you have to do is, once you find that location, is tighten the 5mm screw. Now you also have plantar and dorsiflexion adjustment that's underneath. There's a round knob that you can rotate, and that will give you the ability to move these foot plates and plantar and dorsiflexion. You're going to get about 10 degrees in both directions. These also come with sandals, which we do not have on there. They're going to come in two sizes, a small and a medium. They'll have forward and back movement, as well as side to side. Now, once we have the foot where we want it in relationship to our pelvis, there's a black knob that we are going to rotate. And this will allow for height adjustment in the knee cups and also depth adjustment. Now there is also a 5mm screw on the back side here, and that allows us to fine tune and put the knee cup exactly where we need to be for the appropriate amount of resistance we need. So if they're abducted or they adduct a lot, we can put the more aggressive support in that direction and really capture their leg and their knee so that they do not overcome what we're trying to accomplish. And that way we keep them in the proper position at all times. So it's kind of a safety thing for them as well. So that you do have an adjustment where you can bring it in and out and lock it in the appropriate position. And like I said, you can flip this either direction to give you the optimal amount of support that you're looking for. So we're going to go ahead and tighten that down. And it is very, very difficult to see, but with the abducted stander, there is a little angle finder that is back here. And that will tell you which position, what degree you have the legs set at. Now, it will go all the way up to 30 degrees and for both legs, so a total of 60 degrees of abduction. And most studies have been at a maximum of 30 degrees, but somewhere normally between 15 and 30 to promote the best hip health that you can provide. So once you find that location, you can note it, and that way you can always find where you want to be for that standing program. Now to lock that in position, there's a knob right here. Now this is a ratcheting style, so you can pull this lever down and move it, and it does not tighten or loosen. So we are going to go ahead and tighten this down. Now that way we can lock it in the appropriate position. Now it does not move. So the hips, you have hip pads with little knobs. You can loosen it, and now you have hip width that we can reduce. Okay? We can also expand it. It is Velcro, and everything uses Velcro with an additional securement to ensure that it does not come off. Almost everything has a pinch buckle, so to make sure that we are nice and secure. So once you have the hips in, Okay, and we'll talk about that more here when we talk about getting them in and out of the unit. So we want to be nice and snug on the hips, no more than a finger's width, and make sure that this is nice and snug. There will be an additional pad like this normally over top that allows it to be really snug. And this does come in 4 colors. This just happens to be the red vinyl, which wipes off really, really nice. The laterals for the chest prompt, thoracic area, also just a little thumb screw, allows it to easily move in and out. And if you need to angle it, it gives you a little bit of angle, but not much, mostly in and out. And these are all things that you can really move down, because this is kind of at the highest setting. You can move down all on this spine. So everything moves up and down on the spine and track system for ease of adjustment. This is the tray bracket. So I get that out of the way, just to show you how easily this does move. So it's just a matter of twisting the knob, finding the angle that you want, because you can also adjust the depth here. I can change the angle to get the appropriate angle and push that I want to meet that specific client's needs, and then tighten it back up. This is a pad, and it also keeps, the reason why this is Velcro is a place to keep your straps. So once you tighten them in, you can put your straps in here, and now wandering hands cannot undo themselves or loosen the straps. Make sure that they stay nice and secure inside there. Once again, pinch buckles to make sure that they stay nice and secure. This also has a removable headrest, and it is an additional product where if you wanted to, if you use the Pro Series hardware, you can use Whitmire headrest. So if you needed a contoured or a plush, you do have that ability. Currently on this one is our flat pad, and this allows for the additional laterals. So you can add lateral pads to the headrest to promote a more centered standing. We opted not to put it on this one. They're easily adjustable. They all have knobs or screws, which will be 5mm, so that you can have a in and out adjustment. Put the head where you need it. This hardware also allows you to loosen the 3 knobs, and you can place the headrest exactly in the appropriate position with the amount of support that that individual client needs. Now this is also removable with the cam lock lever. There is a safety button on there so that it does not just come undone. So hands that are playing around can't get to that, or other little friends that are in the classroom or little siblings, does not just easily come undone. So right now we are set up in supine, and this converts to prone pretty simply. So it is a matter of taking the headrest off. There is a little cover that goes on here that makes sure that when they're standing in prone, there's no hard pieces here. So you are able to put a cover on here. The push handles, you loosen and get out of the way for them. And if you wanted to, you could actually lower these as well. There is a screw in the back, once again, 5mm. And if we loosen this, this can actually get out of their way if you would like it to. Because the tray is also going to go on here. can put that in supine or prone and angle adjust. And so when you're putting them in prone, there's a little chest prompt pad here. You're going to lift to the appropriate height to give them enough sternum support for when we have them standing. Now, because this is a 3-in-1, we can put them at a good standing angle just in case there's some that are not weight bearing or we're trying to get them to weight bear more. So just like all the other bases, we have a nice little foot lever. There's a knob here that we're going to pull out, rotate 180 degrees, and it'll lock itself out. Once we do that, we give it a little push, and this will lay all the way back. This will go to 180 degrees, all the way up to 90, which is upright, and anywhere in between. All I have to do is take my foot off the pedal, and it'll lock itself in place. Remember to always lock that pin again, just in case you have animals or other little ones around. You do not want to have them go on a ride by hitting the pedal accidentally. So one of the nice features about the Squiggles standard and the Squiggles Plus standard that really kind of set us apart is the ease of getting the child in and out. So you're going to have them in an appropriate position here in supine all the way down. So you're going to want them laying down. This is a nice height. You will undo the pads, all the straps. And once you've taken your measurements and you've done all the adjustments on where you want them, it is very easy to get them in and out of this standard. So those are some key features that we have. I'm going to put this back up and put this back in supine, the headrest on here. The other thing that this standard allows for is it breaks down, which also sets us apart from some of the competitors. So there's a black knob that is right here, and this black knob pulls out. And so when you pull this knob out, I'm able to take the top section off of the bottom section. So for storage, if I need to, not everybody has tons of room. So I'm able to put this in the closet or take it with us when we go on vacation or to grandma's house. There are also two silver tabs here. Now, if you just try to push these in right now, they will not. I can't make them go. If you place your hand here, lift up on the unit, I'm able to take the tension off of those. Okay? I lift up just a little bit, takes the tension off. Now I'm able to flip this over on top of itself. It relocks so that it can't come apart. And now I have two pieces that are pretty small and compact, and I can put that in the closet. To undo this, all I have to do is squeeze those two tabs again. And put those right there. All four casters lock. So when you're putting this back on, it'd probably be best if you did at least lock a front and a back so that it doesn't move on you. Me personally, I always pull the pin back out, drop it in place, give it a little wiggle, and now it's locked back in. So if you have any questions, please feel free to reach out to your local account manager or to one of us at usleckeyteam@sunmed.com. And have a great day.